Today we'll be talking about melasma. Melasma is a disorder of hyperpigmentation that generally affects the skin of color, and it occurs due to exposure to sunlight. Besides sun exposure, other triggers that can worsen melasma are genetic factors. Yes, it can be familial, and there are other factors like friction, scrubbing, excessive heating due to sauna, steam, or any heat generating procedure can lead to disruption in the skin barrier. Skin barrier is an impermeable protective layering at the top of our skin that protects us against damage or harm. The skin barrier can be weakened in various disorders as well, and it is important to maintain the skin barrier in order to prevent any skin related diseases including melasma. Besides these factors, other factor that is equally important is hormones. Female hormones do lead to melasma. That's why when 10 women are affected, only 1 man can be affected by melasma. Thyroid disturbances and even vitamin deficiencies such as vitamin D deficiency has also been linked to melasma, and these factors have also been sought after when you are treating or looking after patients with melasma. How can we treat it? Melasma is treatable but unfortunately not curable. That we can always improve or clear the signs of melasma, but there is always the risk of the melasma coming back with each sun exposure and with each triggers that I have mentioned above. The backbone of treatment of melasma are sunscreen and sun protection. Sun protection is important, like sun protection with broad brimmed hats, wearing umbrella, not stepping out in the sun during peak hours like around 9 a.m. to 4 p.m. That is also equally essential because sunscreens alone cannot give complete protection against sunlight. That has to be kept in mind. And reapplication of sunscreens is equally important. You have to reapply sunscreen every 2 to 3 hours whenever you are outdoors. Medical therapies. Medical therapies can begin with medical creams, followed by tablet form of medicine, and then clinical procedures. Medical creams that are most powerful and readily available are hydroquinone. However, we have to be careful when we use hydroquinone. Hence, I do not advise use them by themselves without consulting a dermatologist. Azelaic acid is another wonderful formulation that has depigmenting properties as well as anti-inflammatory properties. After azelaic acid, another popular formulation is niacinamide. Mulberry extract, green tea extract, licorice extract, arbutin, green tea, soy, etc. are mild depigmenting agents. Even kojic acid, these are mild depigmenting agents that can be used on a regular basis without much side effects. However, the depigmenting properties are somewhat lesser in these creams. That's why they take longer time. Hence, you have to have patience while using these creams. In some people, melasma might not completely clear off with creams alone. You might need tablet form of medicines along with medical procedures. The most commonly done medical procedure for melasma are chemical peels. Chemical peels, when done correctly, can be rewarding in patients of melasma, especially those who don't respond to above given medicines alone. And the chemical peels that are generally used are glycolic acid, lactic acid, mandelic acid, etc. But a single session of peel will not give you much results, and hence you have to be patient and you have to strictly follow doctor's guidance after the peel is done. Besides that, another one important procedure that I'd like to mention is microneedling. Microneedling is a wonderful procedure that has given good results in my patients. Microneedling has small needles that create channels in the skin, letting the pigment cells get out from the epidermis. It allows the pigment cells to get out from the epidermis. It allows the creams to be absorbed better, and it also allows the drugs or chemicals to be delivered via the microneedle. Hence, they have proved quite efficacious in stubborn, reluctant kind of melasma in my patients. And one last question, are the results permanent? No, the results of treatment of melasma are generally not permanent, and you have to keep protecting your skin, and you have to keep getting one form or the other kind of treatment depending on the kind of melasma and the season of the year. Thank you.